The proposal is called the New York Health Act. It's actually quite similar to the health care plan Senator Bernie Sanders has been pushing for the last few years. All basic private health insurance would go away. You'd get a public option. There'd be no premiums, no deductibles, no co-pays, but more money would come out of your paycheck and the taxes on your boss would go up. But even as this idea is gaining steam here in New York, it's still an uphill battle.
A clear lesson at the height of the pandemic was that the way that our current healthcare system is set up is not efficient and it's not fair.
Serena Probasi and her husband own a small chain of coffee shops in northern Manhattan called Booney Coffee. For years, they've wanted to provide health insurance to their employees, but
the cost of the premiums for ourselves and for our staff basically come to more than what is our total net profit.
That's why Probasi makes a pro-business argument in favor of the New York Health Act. That's the state's universal single-payer health care proposal. It would provide public health insurance with no deductibles and co-pays, and it would eliminate all basic private health insurance, including networks. Advocates are increasingly focused on the business argument because one of the main reasons people are against a single-payer plan is it would be funded with new payroll taxes. A majority of Democratic state lawmakers now favor the plan, having seen many of their constituents lose employer-based health insurance during the pandemic. Queens State Senator Jessica Ramos says the payroll tax would actually save companies money when you factor in all the time and energy spent on trying to get health insurance.
What we're looking to do is take this off the table for business owners.
But Governor Cuomo argues single-payer health care would be better done by the federal government in a unified way, and revamping the insurance system would be unnecessarily disruptive to the vast majority of New Yorkers who already have health insurance. The business owners we heard from today during a virtual forum say it's not about the quantity of New Yorkers who have coverage, but the quality.
The amount of time that I've spent fighting health insurances is really taking away time from growing my business.
Even the prime sponsor of this universal health care plan, Senator Rivera of the Bronx, says it passing without any support from the governor is really just not possible. But as we know, things are changing in Albany with the multiple ongoing scandals for the governor. And the government in general has been more willing to spend money on health care in the wake of the pandemic. So for the first time, this could happen eventually.